Hello, this is Patricia Castro. I am a fellow researcher at Hospital de Especialidades del Centro Médico Nacional, Siglo XXI. And the work I am going to present is Interobserver Agreement in Analysis of Urodynamic Studies and Diagnosis of Bladder Outlet Obstruction in Women. We have nothing to disclose. The aims of our study. The diagnosis of bladder outlet obstruction in women has become a challenge for functional urology. Due to a lack of one widely accepted definition, many different definitions were created with different cutoffs. The objective of this study is to compare 6 different definitions of bladder outlet obstruction and evaluate the Interobserver agreement in a group of 4 residents of general urology and 1 graduated urologist not trained in functional urology. The study design, materials, and methods. After the institutional approval, we invited all residents and attendings of urology service to a theoretical practical workshop, where we explained to them the interpretation of the pressure flow urodynamic studies and taught 6 different definitions of bladder outlet obstruction, as you can see there. After that, we invited just 1 resident of every year and 1 graduated urologist not trained in functional urology. And with prior consent of every participant, we applied a test where they had to evaluate 30 urodynamic studies and classify them in obstructed or unobstructed according to the 6 different definitions. Finally, we asked them to choose the easiest, the hardest, and the fastest definition based on the personal feeling. The Interobserver agreement of all 5 participants was assessed by a kappa statistical analysis. And also, we classified the type of mistakes the participant made by error of interpretation of the urodynamic study or miscalculation in the criteria. In this table, you can see our results, and we obtain a substantial agreement for Farrar, Chasang, De Freitas, and Blives routes. And we obtain fair agreement for Lemac and Solomon-Greenville. The p-value were considered as significant with values less than 0.05. So this study proved less interobserver variability and highest agreement between Chasang, De Freitas, and Farrar definitions. In this table, we can see the classification of the mistakes made for the participants. So from a total of 840 responses, we found 120 mistakes. We classified the type of mistakes the participant made. And this table shows the number of mistakes made by year of residence. So this study shown less error rate as the year of residence increased. This can be explained by their experience in the rotation of urodynamics department. So here, with the graduated urologists, we can see a higher number of mistakes. And this can be explained because its main practice is not related with functional urology. And finally, 100 of the participants choose the Solomon-Greenville as the most difficult definition. And for the easiest, 40% choose De Freitas and the other 40% choose Farrar and 20% Chasang. For the fastest, they choose 40% De Freitas and 40% Farrar and 20% Blives Krauts. So these definitions also show less mistakes and were considered fast and easy when applying the diagnostic criteria. Solomon-Greenville was reported as the most difficult and had more mistakes in miscalculation. And this might be because it implies a complex formula. So as a concluding message, Chazang, De Freitas, and Farrar definitions prove substantial interobserver agreement, and Solomon, Greenville, and Lemack were definitions where the highest number of pitfalls were seen, also the lowest level of agreement. Thank you for your attention.